So, good day everyone. My name is Betty Hernandez and I'm first year college from the SN1D. So now I'm going to demonstrate to you the breast and axillae assessment with our patient. So first I'm going to introduce myself to our patient and verify his name. So good day sir, I'm your student nurse for today and can I ask what is your name?
Ivan Ramos.
Okay, so next, I will assemble, after the verifying the client's name, I'm going to assemble the equipments and the things that I will be needing. First is the centimeter ruler and disposable glove if necessary. After assembling the equipments and supplies, we will now proceed in the first procedure. But first, we need to explain to the client what we're going to do, why it is necessary, and how she can cooperate. So the rationale is for the patient awareness in what we're going to do and why it is necessary. So good day sir, for now I'm going to assess your breast and for us to know if there are any abnormal findings that we will be detected. So next, we will provide client privacy to our patient. So the rationale is for the patient to be comfortable in the whole procedure. And for example, we need to close the curtains. If we are in the examination room, close the door. So after providing client privacy, we need now to do the wash hands and observe other infection control procedure or the hand hygiene. So the rationale is for us to avoid the spreading of microorganisms or the cross-contaminations among patients or clients. So for this procedure to be more successful, we need to ask to our patient if he can take off his shirt. So sir, is it okay to you to take off your shirt?
Yes.
Okay. Good. Okay. So after that, with the consent of the patient, we expose the breast area and now we will inspect for any masses or any lesions or any tenderness in the breast of our patient. Okay, after that, now we need to inspect the breast of our patient for the size, symmetry, contour, or shape. Also, we will inspect the breast for the localized decoloration, hyperpigmentation, and retraction or any dimpling, swelling, or any edema. So, sir, can you please straight your body? Okay. So, the patient breast is actually normal and has the same size since our patient is male. And then, the color of the breast is actually the same with his skin tone and the texture is smooth and no edema detected or any abnormalities. So now we're going to emphasize if there are any retraction with the breast of our patients by raising their arms, push the hands together or with the elbow flex, and then press the hands down on the hips. So sir, pwede niyo po bang pakitaas yung arms niyo po ng ganito? Okay. So next, pwede po bang pakilagay po sa hips po? Okay. After that po, pwede po bang pakilagay po? Then, press your arms together with the hips. Okay. Okay na po, pakirelax na po yung kamay. So, it is the same color with his body and there were no lesions, no masses, no swelling, and no redness detected. And the client breasts are actually symmetrical. So, there are no any signs of dimplings or any retractions. So now, sir, we're going to inspect the areola for size, shape, symmetry, or any surface characteristics, and if there are any lesions or masses detected with the breast of our client. So, now, sir, can you please take your body? Okay, so the patient's areola are dark brown. There are small geometry on tubercles that present, and there is no lesions or any masses detected. everything is normal. So now we will proceed inspecting the nipples of the patient for size, shape, position, and for any discharge or lesions with the breast of our patient. So sir, straight your body. So the patient's nipple are equal bilateral for the size and also same location on each breast, and there are no any discharge or any lesions or any masses detected with the breast of our patient. Next, we're going to palpate the axillary, subclavicular, and the supraclavicular lymph nodes of the patient. So, sir, can you please raise your hand? So, sir, do you feel anything? Do you feel anything po? Okay, sa kabilang kamay na. Do you feel anything, sir? Okay. So, there is no problem detected. No tenderness, no masses, everything is normal. No abnormal findings detected with the axillary, subclavicular, and the supraclavicular lymph nodes of our patients, both left and the right side. So now we're going to palpate the breast of our patient, and we will observe if there are any masses, there are any tenderness or any discharge on the nipple of our patient, both right and left. So sir, can I touch your breast bone? So sir, do you feel any pain as I touch it? So sir, do you feel anything? So there are no any pain detected with our patient, both right and the left breast, and there are no masses, no tenderness, no lesions, and no any discharge on the nipple of our patient. So now I'm going to palpate the areola of our patient and the nipple, both right and side of our patient. So sir, can I touch again your breast? So sir, do you feel any pain as I touch it? Okay. So the patient doesn't feel any pain as I touch it. There is no discharge presence, and also there is no tenderness while I'm palpating the areola and the nipples of our patient. So everything is normal and no abnormal findings detected. So after all the procedures that I've done with the patient, now I'm going to teach him on how to examine his breast by himself on his house. So okay, so sir, you can do this once a month. So the first step is raise your armpit. Raise niyo po yung kamay niyo, sir. Okay, so after that, we need to use our fingers and put some oil or shower gel. Ako na lang po. Okay, so we will now palpate the breast of our patient, up, down. Both left and the right. Next, in wedges. Also, in the next step, you need to face on the mirror and check if there are any lumps or skin dimpling detected. Also inspect if there are any changes in skin color or texture, and lastly, check if there are any nipple deformation, color changes, or leaks of any fluid. So sir, do you follow the breast examination by yourselves?
Yes.
Okay. So sir, you can do this once a month and follow the rules properly. So that's how I demonstrate to you the breast and axillae assessment. And after all that, I need to document all the data gatherings that I've gathered in our patients. Okay, so after that, I need to do the hand hygiene. So that's how I demonstrate to you the breast and axillae assessment.